Good morning, everyone. Thank you for being here. My name is Emily Volland. I serve as the Director of Communication and Community Relations at Kadlec. I've had the privilege to serve here for almost 20 years. March will be 20 years. And it's been pretty incredible over that 20 years to be able to just see how deep the partnership and collaboration between Kadlec and the City of Richland, and specifically Richland Fire Department, has really grown. We are so grateful for our friends, really our family with Richland Fire, and grateful that you're all here to celebrate kind of another milestone in our partnership. So I am pleased this morning to introduce John Amundsen, who is the City Manager for Richland.
Thank you, Emily. Appreciate that. And today we gathered to celebrate the Heart Safe Campus designation presented to Kadlec Regional Medical Center in collaboration with Richland Fire and Emergency Services. This designation is representative of our shared visions between the City of Richland and Kadlec to have a positive impact on our community. Kadlec Regional Medical Center is a vital asset to our community. We value the investment Kadlec has made by pursuing the Heart Safe designation and continue to support their mission to improve health and well-being for all Richland residents. I extend my gratitude to Richland Fire and Emergency Medical Services and Kadlec Regional Medical Center for their dedication. Let this celebration mark the continuation of our partnership as we jointly build a healthier and safer future for Richland. May our shared vision continue to guide us in positively impacting our community for years to come. Thank you.
Thank you, John. I'm extremely excited to be here today to recognize Kadlec Regional Medical Center as a Heart Safe campus. It is extremely fitting that we are here today on October 16th, which is World Restart a Heart Day. At Richland Fire and EMS, one of our legacy initiatives is to be best in class in cardiac care. In order to strive for this goal, we took a holistic approach and realized we need help from our entire community to make this a reality. Heart Safe Richland was built with this goal in mind. Heart Safe Richland is a public education initiative to increase neurologically intact survival from cardiac arrest. Our slogan for the program is "Don't wait for help, be the help." We want to empower everyone to know Hands Only CPR and for them to realize they truly have the power to save a life in their hands. Studies have shown that one of the most important links to cardiac arrest survival is bystander CPR prior to the arrival of EMS and fire personnel. For every minute that no CPR is performed prior to EMS arrival, the chances of surviving decrease by 10%. If our response time to a cardiac arrest is 4 minutes, this means the patient is 40% less likely to survive if no one starts CPR. This life-saving initiative focuses on 4 areas surrounding cardiac arrest. It's the recognition of what cardiac arrest looks like, it's emotional preparedness, it's how to perform high-quality CPR, and it's the effective use of an AED. As part of this initiative, we have established guidelines for businesses to become a heart-safe campus. If a business trains 70% of their employees in hands-only CPR and has an AED on site, they can receive the designation of a heart-safe campus. To date, we have dedicated 16 heart-safe campuses across our region, and Kadlec Regional Medical Center is the latest recipient of this recognition. I know it may sound like cheating to say that a hospital is a heart-safe campus because of all the doctors and nurses who know CPR, but this award is focused on the non-clinical staff at the hospital. Richland Fire and EMS, in partnership with the clinical education team at Kadlec, were able to train just over 200 of the hospital's non-clinical staff in hands-only CPR, and that equates to 90% of the non-clinical staff. Again, you might say, but the hospital is full of doctors and nurses that will be there should sudden cardiac arrest strike. The benefit of this is we now have 200 trained bystanders who can provide the life-saving skill of hands-only CPR out in the community. This is 200 more people in our community who won't wait for help, they will be the help. Thank you for Kadlec for your support and dedication to improve survival from sudden cardiac arrest in our community.
Thank you for the opportunity. I would like to use these 2 minutes really allowed to me to pass a message to the community. And this message is around what the community can do for our patients. All right, so when we talk about chain of survival in medicine, ACLS, and what we teach is based on 5 different things. And the key word is early. Early recognition, early CPR, chest compression, early AED and defibrillation, but also ACLS and early post-resuscitation care. The first 3 parts is based on the bystander, not on the ACLS crew, not by the doctors or the ACLS educators. So and here's a tip, here's an incentive for the community. If we start CPR and if we recognize that the patient's heart has stopped in the first 1 or 2 minutes, 45% of the patients who had a cardiac arrest do survive. So that's your incentive. 1 in 2 patients who you would start immediately within the first 1 or 2 minutes CPR, you will save. And that's a big thing. So with that, I would encourage patients to understand the why behind that. The first 2 minutes are extremely crucial because we're saving the heart, but we're also saving the brain. A lot of times we save the heart and the brain fails. We don't want that. We want early recognition. If you have a suspicion that the heart had stopped, don't waste your time. Start CPR and call 911, get the AED and do your job. So we appreciate that. At the end, I want to send a couple of shout outs for the 911 crews nationally, but surely locally. I'm an intensivist, so I see them every month for the last 15 years at Kadlec. They do a fantastic job. They're well educated, well trained, and they help us quite a bit with the initial stages of arriving to the hospital. And the second shout out is to Kadlec Center. I'm also an educator, and with Megan and her administrative lead and leadership, 2 things about this. They teach ACLS and basic life support not just to caregivers, but also to community members. So I encourage people to use Kadlec to come and register and learn basic life support. It'll make you feel a better person in the community and better ready. And the second thing, they teach not just adults, but also kids. Unfortunately, kids are subject to cardiac arrest to different reasons than the adults. And if you register for BLS, you'll save kids as well. So with that, have a great day. Thank you.
I'd like to invite Megan Boucher up. She is the Kadlec Training Center supervisor, and her entire team, actually, if they want to kind of come up here.
They're very excited.
So I just want to say thank you. We couldn't have done all of this without your help and your entire team's help to get this accomplished. Training 200 people takes a lot of work and a lot of dedication. I'm extremely proud of the partnership that we have. So I'd like to present this award and designate Kadlec Regional Medical Center as a Heart Safe Campus. Thank you.
Get my little cheat sheet out here. But first of all, I just want to say we really are excited to be here, and we are really honored to accept this award. It's wonderful that we are now a Heart Safe campus. That designation was important to us. We've been a part of this for several years, and it's time. So we're really grateful, and we want to accept on behalf of all of the caregivers here at Kadlec. We had a lot of help and a lot of support. I want to also thank Richland EMS and Richland Fire, as well as the Kadlec Training Center team. There was a lot of collaboration, a lot of support, and a lot of hard work that went into this, and so we're grateful. I'm also thankful that we are part of such an amazing program, this program that you can use in your locations, in your facilities, in your campuses. So I encourage you to check into it and see if it's something you want to be a part of as well. We're grateful that there's a program that helps to improve outcomes in the community, and we're also grateful that we now are a part of that program here at Kadlec to improve outcomes here on our campus as well. So thank you, we are truly honored.
Good morning, and thank you all for being here with us. I just want to add my thanks and congratulations to what you've heard. First to the City of Richland and Richland Fire and EMS for having the vision to pursue this safety initiative for the city. Keeping all of our citizens well and safe is a shared mission that we all have, and just so appreciative to be part of this. I also want to echo my thanks to Megan and her training team. As you heard Michael Van Beek say just a minute ago, they've trained over 200 of our non-clinical caregivers here to help with this initiative. I'd echo Dr. Ganem's support for others in the community that might be interested. As a non-clinical person myself, I've been through the BLS training, and don't feel as comfortable maybe as some of our clinical teams that are expert in that, but feel a little more comfortable knowing that I could do something if something happened as a bystander in the community. And we just encourage everybody to support this initiative. And again, thanks to the city, fire department, EMS, and to our teams for pursuing this, and to you all for being here this morning.
From the very beginning, Heart Safe Richland has had just amazing, amazing support from our city council, from our city manager's office, from our department's leadership. I would propose to you that the ability to have impact in the community the way that we have has rested on not just that support, but the support, investment, partnership, and collaboration with the leadership from Kadlec Regional Medical Center. And as critical as that support and investment is from the leadership of our two great organizations, the actual impact to our community happens when people are willing to step into the gap and provide these life-saving measures while EMS is responding to take over patient care, and while EMS takes over patient care and delivers to definitive care here at Kadlec Regional Medical Center. So my job here this morning is to wrap up and to say thank you. And so I want to say thank you to the leadership of both of our organizations. I want to say thank you to the EMS crews who provide these services day in and day out, along with the ER and cardiac staff here at Kadlec Regional Medical Center. And maybe even more importantly, I want to say thank you to all of the staff here, the 200 people who are now trained up in a way to be the lifesaver, to begin that chain of survival for people all over our community from this amazing facility and this amazing group of employees. My heartfelt thanks to everybody that supports this program, for everybody that's here today, and let's make this the starting point and see what we can do from here. Thank you and have a great morning.